My name is Aline and I was at Spire Edinburgh Hospital for cardiac catheterisation just about 8 weeks ago. Cardiac catheterisation is a procedure used when you have a problem with the arteries around your heart. If there's a little narrowing in any of these arteries, then this procedure is where they have a look at these arteries from the inside, and in my case they went in through the groin. Normally it can be done through the wrist, but because I've had previous procedures it was necessary to do mine through the groin, and so they put a dye through and find out where there are any narrowings in the arteries, and where they find a narrowing in the artery, if it's at all possible, then they put in what they call a stent. And a stent is like a little cage that is used to hold the artery open. They do this by putting in a little balloon to open the artery to keep it nice and wide, and then they put in the little stent to hold it open, and that allows the blood to flow more freely and saves me, I hope, from having a heart attack. I found the Spire Edinburgh Hospital, and I then went to my GP and asked him if he could refer me, and he did. And within a very short time, a week and a half perhaps, I had an appointment to go and see Dr. Flappen, and we had a chat about my previous heart history and how my heart was working and why I was feeling that I was needing any further procedures. I explained to him that I was having difficulty, or more difficulty, walking up hills, and more difficulty when I was swimming. I was having a little more angina than I'd had before, and I thought perhaps that I was needing to have this checked out. That means an ECG test, which is simple, straightforward, just lots of nodes put on here then, and just sit still for a minute, completely painless, no problems. And then after the ECG test, the dreaded treadmill test, which I've had before as well. And it's just walking on a treadmill with continued blood pressure checks and also doing tracing of the heart. Once we'd decided, when we looked at that yes, there was a problem. It wasn't a serious problem, it wasn't immediately urgent, but it was a problem, and it was a problem that needed to be addressed. So Dr. Flappen suggested that I have an angiogram, and an angiogram is, or sometimes they call it an arteriogram, same thing I think, where they decide to put the dye into the groin and through the heart and find out exactly where the narrowings are. And that's what we decided to do. So I went away home and waited for my next appointment. So I arrived at Spire Edinburgh, was taken upstairs. I have to say I was quite surprised when the nurse came and chatted to me, reminded me what was going to happen, and then said, right, off we go then. And I had to walk. So I walked to the theatre, into this brand new unit. At least it looked brand new to me. I think it's about 3 years old, but it's very nice, very state of the art. And in I went and got myself up onto the bed, and then waited for things to happen. I didn't feel anything very much at all, I must say, very little. I was given an injection, I think of something I think it was a painkiller of some kind, and also something just to keep me nice and calm. I think I was quite calm anyway, but I'm happy to take whatever would make me more calm. And then he injected the dye into my groin. They were very chatty and very pleasant, I have to say, in the unit. All of the staff there were very, very nice. Always checking to be sure I was all right. Dr. Flappen talking about his fishing trips, and everything was very relaxed. So I was quite comfortable. The outcome was that there was one narrowing in one of the grafts. I had my coronary artery bypass graft done 20 years previously. So it wasn't really surprising to find after 20 years that one of them was beginning to narrow a bit. So eventually the stent went in. It seemed a few minutes really, and it was done, and I was fine. It was great. It took me 2 or 3 days to really feel absolutely A1, but I was absolutely A1 after 2 or 3 days. So I'm now feeling really well. I'm able to play my golf again twice a week and get up the hill at the third. I can go to my aqua aerobics classes. I do that 2 or 3 times a week, and I'm able to give 100% again. I go walking with my husband. He's keen to hold me back because he says I'm going too fast. So I'm feeling really well and very fit. I'm also feeling very confident because I've seen the inside of the workings of my heart. I've seen these arteries. I've seen that they're all open and that they're all functioning well. And that gives you a lot of confidence. And so I'm very happy, yeah.